Alright, hi everyone. First of all, I want to apologize for canceling class this morning. I had to put a lot of thought into whether or not we were going to meet today, but I was just concerned about the safety of myself making it from Starkville, but also of my students. I didn't know how far some of you had to drive, and so I thought it would be better if we just did an online lecture today. So I'm going to send this link out, and if you would, please watch this video before we meet on Thursday. So today's lecture will cover material picking up where we left off last time. Last class period we talked about Sternberg's theory of intelligence, and so we have maybe analytical intelligence, practical intelligence, creative intelligence. We talked about how not everyone is high on all of those, but usually someone has better on some things than others. So today's lecture is going to pick up where we left off there and start with Gardner's theories of intelligence. So we're going to talk a little bit more about theories of intelligence, and we'll also talk about types of learners. And then today we'll start talking about students with disabilities, and we'll pick up with the remainder of that lecture on Thursday. So let's go ahead and get started. Another theorist, Gardner, had the idea that we have different types of intelligences, and not everyone has all of these types, right? But each person has some of them. And Gardner's theory is often talked about when we think about someone who is a savant, right? Savant meaning someone who has a particularly high skill in some particular area. Very intelligent in a certain aspect, but perhaps average or below average in other aspects. I don't know if you guys have seen the Rain Man movie. Tom Cruise is taking care of his brother, Dustin Hoffman, who has autism, has an autism spectrum disorder, which we'll talk about autism spectrum disorders next time, but he is having a lot of trouble functioning in a lot of different areas, but he does have some savantism. He's able to count cards, right? So he's good at cheating in poker. But there's also a scene in the movie where he can memorize the phone book, and he just starts spouting off people's phone numbers and names. Or when they drop a box full of toothpicks and he counts the number of toothpicks immediately, right? So there are some skills that he has that are considered maybe savant skills, but he's particularly low in other types of intelligence. So Gardner would say that we each have different types of intelligence, and that allows for savantism. It allows us to be particularly good at one area and maybe be average or below average in other areas. Now, Gardner came up with 8 types of intelligence that he found some research support for. Verbal, mathematical, spatial, bodily kinesthetic, musical, interpersonal, and naturalist. So someone who's high in verbal intelligence is someone who's maybe a good public speaker, who is good at comprehending and understanding written and verbal material. Mathematical intelligence would just be someone who is, of course, very talented with different mathematical skills. Spatial intelligence would be someone who's particularly good at picking out patterns, puzzles, nonverbal things, sort of like we were talking about earlier with the perceptual reasoning, but also maybe someone who's good at directions, for example. Bodily kinesthetic, so you can think of this as someone who is maybe athletic, so a professional athlete or someone who dances, right? Someone who uses their body in these ways that we can't normally do, most people can't do, right? And then musical intelligence, so being able to sing, being able to play different musical instruments. Some people certainly have a strong talent here. Now, intrapersonal and interpersonal are a little bit different. Intrapersonal is focusing on yourself, being able to understand yourself, knowing yourself, being able to understand your emotions and cope with your emotions, just knowing who you are. Versus interpersonal would be knowing other people, being able to understand other people's emotions and feelings, being able to relate well to other people. Good. And then naturalist, being able to be successful. This person would be the person that we could put out into the wild and they could hunt and gather and do just fine, right? So different types of intelligence here. So another type of intelligence that you may hear about is emotional intelligence. So emotional intelligence is the ability to perceive and express emotion accurately and adaptively. So what does this mean? Being able to understand other people's emotions and being able to handle your emotions. So you're accurate at understanding other people's emotions and your emotions, and you're able to use them adaptively, right? Being able to understand emotion, right? Knowing about other people's emotions, what emotion is appropriate, what's not appropriate, right? Using emotion to facilitate thought. So this may be difficult. Some people, when they are particularly emotional, it may be difficult for them to think. But someone who's high in emotional intelligence can use that emotion, maybe channel that feeling to help them accomplish something. and being able to cope with emotions and manage emotions in their self and other people. Now, I don't know that this is accurate. I haven't seen the research on this. This may be a stereotype, but in general, women are considered to be maybe higher on the emotional intelligence than men, right? And I would like to get some feedback on this, what you guys think. But typically we think of women as being able to understand other people's emotions better and being able to cope with emotions better, and that men maybe don't understand emotion, particularly maybe women's emotions. This may just be a stereotype, but it's one that we hear pretty often. So take a minute and think about yourself. How are you intelligent? What particular type of intelligence do you think that you're high on? And how have the teachers that you've had in the past accommodated you and helped you develop that type of intelligence, right? Maybe you needed a little bit of extra help in some areas. Maybe you were advanced in other areas, and so you needed more work to help keep you challenged, right? Think about how teachers have accommodated your particular type of intelligence, and how could you accommodate your students' type of intelligence, right? So if you're planning on teaching, you'll see a classroom full of students that have different types of intelligence and that need individualized attention because of that. And so how are you going to use that information to help you be a better teacher? Also, this is interesting, and I wish that I could get your thoughts and your discussion on this. Should schools use intelligence tests for placement purposes? So I also want to talk for a minute about the debate regarding intelligence tests being used for placement purposes. And so here's the idea that we take students that score low on intelligence tests and maybe put them in special education. We take students that score high on intelligence tests and put them in gifted classes, and kind of split students into groups based on their ability levels. There are a lot of different sides to this. On one hand, students who are a little bit behind could get lost in the classroom. If you keep them in the regular classroom with other students, they may get lost. They may not be able to get the individual help that they need. And that's obviously not good. On the other hand, students that are gifted, if they're left in the regular classroom, might get bored and might start acting out, or they're just not learning anything because they're so far ahead. And so there are some advantages to splitting them up and getting them more individualized education. Individualized education is very important for everyone. On the other side of things, though, when we start splitting kids based on their intelligence, we are telling them something about who they are and about their self-esteem. If we take students and say, because you're behind, we're going to put you in a special room, what does that do for their self-esteem? And what does that do for their expectations for themselves? We can kind of start a self-fulfilling prophecy here. In other words, they expect that they won't do well, so they don't do well, right? And we can cause emotional damage here. On the other hand, we take kids and we tell them that they're going into the gifted rooms and the gifted debate. Is there any drawbacks to that, to putting kids in a special room for gifted kids? I mean, maybe they start to let it go to their heads a little bit. Maybe because they're not with their other peers, then they don't get as much of a chance to socialize with kids their age. But for the most part, I think gifted programs have more advantages. But it is challenging to think about whether we're going to use intelligence tests. If we have an intelligence test, that's just one score, that's just one piece of information. And so I'm not sure that intelligence tests alone are enough information to make decisions about placement purposes. But there is a very active debate here. It's important for you to think about your opinion on this, because you may be asked to weigh in about a child in the future if you're a teacher. The parents, the principal may want to ask your opinion on, should we move this child to another classroom? And so thinking about the advantages and disadvantages to that and what you would suggest in that situation, it might be good to start thinking about that now. Nature versus nurture in intelligence. So we talked about nature versus nurture in this debate when we were talking about development. But this is going to continue to come up and be a theme throughout the course. So related to intelligence, we all have a certain level of intelligence. Is that because we were born with that level of intelligence, or is that because of our environment? If you think about the genetic components, then that's nature. If you think about environmental components, then that's nurture. And my thesis advisor explained this to me when I was taking intelligence testing class with him, that you can think of it almost like a rubber band. You're born with a rubber band, and that is your nature, right? You can only stretch a rubber band so far. You can only make it so big or so small, right? You have a range there. But where you fall in that range is based on your nurture. So the nature side of things is the rubber band. It's the range of intelligences that's possible for you. Some people may not be possible to reach this certain high level of intelligence, right? But they have a certain level that they can reach based on the nature that they were given. And then where they fall on that range, whether that rubber band is completely stretched out or not stretched out at all or stretched out a little bit, where they fall within that possibility of ranges for them is the nurture, right? Based on the parenting they received, the school that they went to, the environment that they had, the peers that they hung out with, right? All these different things play a role. So my own personal opinion is that you cannot say that it's one or the other in most cases. In most cases, it's both nature and nurture. There's certainly an argument, though, that there may be some cases that are primarily nature and some that are primarily nurture. For example, you take an individual with Down syndrome, that's nature, right? That's biology, but that may play a role and is very likely to play a role in their ability to do well in a classroom and to score high on an intelligence test. So that's very high on the nature. But you can take a child that doesn't have any nature problems and put them in a bad environment where they are neglected or abused, and they're not going to do well, right? It's very unlikely that they will do well. Just because it's hard to focus on scholastic abilities when you're hungry or when you're being abused, right? When you're afraid. And so whether it's nature or whether it's nurture, I would say for the most part it's both. But there may be some cases where it's primarily nature, primarily nurture, and maybe it varies for each individual. So take a second and think, your level of intelligence, is that because of the nature that you received through genetics, or is that because of the nurture that you received through your environment? Also, be thinking about how you can use that with your students in the future. I really like to think that we can change. I really like to think that we can help our students grow, that we can be a force for good. And so I would really like to say that it's nurture. It's at least partially nurture, so that providing good education, providing good diet, providing good encouragement and support can make things better for our students. That may just be me being optimistic, but I would really like to think that it is that way. Good. So next we're going to talk about different learning and thinking styles. So we're going to talk about impulsive versus reflective styles, and we'll also talk about deep versus surface styles. So just some individual differences in the way that we learn and think. So reflective versus impulsive thinking styles, this really has to do with how quickly students provide answers. Students who have an impulsive thinking style may quickly blurt out whatever answer comes to mind first, may be more concerned with the speed at which they are able to do their work and less so with the accuracy. On the other hand, reflective thinkers are going to maybe take their time to answer a question, but they'll be more likely to think critically about it. They'll be more likely to make sure that they give the right answer. They're more worried about accuracy than speed. So reflective students in general tend to do better than impulsive students at remembering structured information. So this would be very helpful for exams. Also reading comprehension. And so maybe students that are more impulsive thinkers read through the material quickly and maybe don't spend as much time focusing on the details, whereas the reflective style thinkers may read more slowly, but they're focusing more on what kinds of questions might be asked from this material, making sure that they really understand the material. So once again, more focused on accuracy than speed, right? So reflective students are also going to do better at problem solving and decision making, probably because they would slow down and take the time to consider different solutions for problems as well as different possible decisions and the consequences of those decisions. They're going to do better at goal setting and in general setting higher standards. And so reflective students might be more of the students that are concerned about their grades and want to do well in the classroom. And so this is a couple of different styles of thinking here. And so we want to think about ways that we could help students that are a little bit more impulsive. So teaching children to stop and think about different options. For example, if we're doing problem solving or decision making, maybe we don't allow them to just produce one answer. Maybe we have the assignment requires this reflective thinking where they have to think of several different answers and the consequences. So we can kind of demonstrate this for them and set up assignments that require them to do this to try to help them improve these skills. We also have deep versus surface learning styles, and really the difference here is whether or not students are thinking critically about the material. So some students that are more focused on surface learning will kind of memorize the information for the test, and then that's about as deep as it goes, right? So they're really more passive learners, meaning that they are receiving the information from the teacher and are trying to learn it. They may put a great deal of time into learning it. They're not thinking critically about the information, so they're not going to tie that information to a larger framework, or in other words, they're not going to use it to see the big picture. And they're going to focus more on the external rewards, like, for example, the grade on the test. So these students will take the material that is taught to them and they will learn it as much as needed to be able to, do as well as they'd like on the test, and then they're done with the material. On the other hand, deep learners are going to construct their knowledge, so as they learn new things, they'll try to put it together to get the big picture idea, to give meaning to the material, so maybe thinking of their own examples, thinking how they could use the material that they're learning. They may be focused more on internal rewards, and so I'm sure that grades are important for these students as well, but it's also important for them to feel like they're learning, to feel like they're able to use the information that they are receiving in a meaningful way. And they tend to be a little bit more self-motivated. And so these might be students that are more willing to do their work on their own and may not need as much of the external reward that a surface learner might need, right? So if we have students that are just learning the material to do well on the tests, first of all, we can't blame them for that. Our society is sort of set up that way, that it's important for us to be able to do well on tests, especially when we think about the public school system and having to do well on standardized tests. It may be very important for students just to be able to regurgitate the material on the exam. But we really want to teach children to be deep learners, and we can try to do that by demonstrating critical thinking, by requiring critical thinking on the test or on the assignments that we do, having a lot of discussion, having students kind of come up with their own examples. These are all things that can help students tie the material that they're learning to a deeper meaning to get the bigger picture idea. Well, we have to keep in mind that in any classroom in which we're teaching, there may be several different learning styles that we have to accommodate, and that's a lot of hard work. So here we're talking about learners who are exceptional. The school system may do really well with students who are average, right? But we may struggle with students that are different, right? Either students that are below average, which will be the students that we're talking about today, or the students who are above average, which we'll talk about next week. It may be particularly difficult because we tend to have to teach to the median, right? We have to teach to what the majority of the children are doing, and this may not include some children. So today we're going to talk about some different issues that may come up in the classroom and how to help these students the best that we can. So we'll talk about students who have learning disabilities, ADHD, intellectual disabilities, physical disorders, sensory disorders, autism spectrum disorders, and emotional and behavior disorders. So we're going to touch on a lot of different issues here, and we'll get to many of the issues, but there may be more issues. There may be other things that come up in the classroom, but I'm hoping that you can take away from this lecture some tips on how to deal with learners who are exceptional, who may not be like the average student. So starting off with learning disabilities, and one important note here is that I'm using information from the DSM. So the DSM is the Diagnostic and Statistical Manual of Mental Disorders. It's a very large book that is used for diagnosis, and it's on its 5th edition right now. And so inside the DSM are all the different criteria to meet all these different disorders that are diagnosed. And learning disabilities is included in the DSM. And so this is what it was referred to in the DSM as specific learning disorder with impairment in blank, and you would fill in the blank here. So children who have learning disabilities are having a hard time learning, obviously, and usually it's with a specific area. So we might have specific learning disorder with impairment in reading, for example, or specific learning disorder with impairment in math. Okay, you've heard this called a variety of different things, like, for example, dyslexia, reading disorder, all these things. They're really referring to learning disabilities. So the way that this is diagnosed is that children who have learning disabilities tend to be performing poorly in a particular area, and it's not what we would expect based on their intelligence. So for example, if we have a child who has average intelligence but is far below their classmates in reading, We know that it's not an intellectual issue, maybe a learning issue, right? Perhaps we have a student who has a high average intelligence but a low average math performance, right? So we're having a student here who their intelligence and their learning ability and what they're showing in the classroom are not matching each other, right? Now, typically these tend to be lifelong issues. So students who have learning disabilities may have to deal with this for the rest of their lives. It may be particularly difficult for them. Some outcomes that could be related, poor academic records, high dropout rates, poor employment, and having a hard time with secondary education, right, getting a college education. These are some outcomes that can happen with children who have learning disabilities. But this doesn't necessarily mean that this has to happen. This is not to say that individuals with learning disabilities cannot be successful, because they absolutely can. They just have one more hurdle to overcome than others. So some strategies for working with students with learning disabilities. Take the needs of the child into account during instruction, so always be keeping in mind what the child might need from you and provide any accommodations that you can. So this may be that the child needs extra time to take tests. Maybe they need a quiet environment to take tests. They may need a little extra help, a little more hands-on help. Good. Helping them improve organization and study skills. For example, so students who have a reading disorder may need different study skills than students who do not, right? And working on them with these skills, it's important to try to develop whatever the issue is as much as possible. If they have problems with writing, we need to work with them as much as possible on writing. Maybe get some one-on-one tutoring in addition to what they're getting in the classroom, right? And then challenging students to become independent and reach their full potential. And this is so important. We often end up setting up a self-fulfilling prophecy, right? Where we tell students, you have a reading disorder. And what they hear is, I can't read. And then they don't try. And if they don't try, they certainly can't read, right? So we want to be careful what we tell students and how this plays a role in their self-esteem. We want to say, yes, you do have a specific learning disorder with an impairment in reading. That doesn't mean that you can't learn how to read, though. It just means that it's going to be a little more difficult for you and that you're going to have to work a little bit more. But that doesn't mean that you can't do it, right? We want to encourage students and try to challenge them as much as possible to help them reach their full potential. We don't want to set up a self-fulfilling prophecy here that could backfire on the child. So the next disorder that we'll talk about is ADHD, right? Attention Deficit Hyperactivity Disorder, which has been called a lot of different things, but the DSM refers to it as Attention Deficit Hyperactivity Disorder. Now, something to keep in mind with ADHD is that there are 3 types of ADHD. You have the primarily inattentive type, the primarily hyperactive type, and then the combined type. So with the primarily inattentive type, these children it may be harder to tell that they're struggling because you may not actually see them struggling. It's hard to look at someone and know whether or not they're paying attention, right? But children who have that inattentive type have a hard time staying on task. They have a hard time with anything that requires sustained attention. Good. On the other hand, we can have students who don't have as much of an issue with attention but have more of a problem with hyperactivity. These will be the children that are often first diagnosed, right? The ones that are getting out of their chair during class, the ones that can't sit still, that are always fidgeting, maybe distracting other students, right? So we can have the primarily inattentive type and the primarily hyperactive type. We can also have a combined type, which is, of course, a combination of inattentive and hyperactive. And so these individuals would meet criteria for both inattentive and hyperactive presentations of ADHD. Now, the onset is typically in early childhood, and this means that most people who have been diagnosed with ADHD later in life can look back and say, yes, I've been like this my whole life. But one issue with this is that we tend to look at children who may be a little bit more active than others and perhaps falsely label them with ADHD. Diagnosis of ADHD has been steadily on the rise, and this could be for several reasons. It may be that we're getting better at diagnosing it, right? We're getting better at learning about it. We know more about it now than we did 20 years ago, and so it's easier to define it. And I hope that that's what it is, because I don't want to think that we're wrong, but there's also the possibility that we are just placing expectations on children that are beyond what they can handle. Remember that we talked about the prefrontal cortex is still developing until you're into the mid-20s, and so it may just be that these children are not able to pay attention at the rate we expect them to because they're just not developed yet, right? And so ADHD is definitely a real thing that does occur, that does cause impairment, but I'm worried that sometimes it could be overdiagnosed if we just are trying to figure out why children are so active, right? We are putting more and more of an emphasis on education these days, which is really, really good, but it also means that we're taking children at younger and younger ages and expecting them to sit still and pay attention for longer and longer periods. And this could be playing a role in the difficulty that some children have in attention. So just something to keep in mind. So in order to get a diagnosis of ADHD, it has to be causing impairment. And this is for just about any disorder in the DSM. To get a diagnosis, it has to be causing some kind of impairment, which means it's either causing them personal distress, it's interfering with their schoolwork, or in older individuals with their ability to work at their job, right? Or with relationships, good. So interventions typically include a combination of academic, behavioral, and medical interventions, but primarily the first line treatment, if it truly is ADHD, is stimulant medication, is usually the most supported method of treatment. But we really want to take a holistic approach here, and in addition to the medication management, we also want to include some behavioral and academic interventions that can be helpful as well, right? So strategies for working with students with ADHD, first of all, monitor stimulant medication. We want to make sure that children are getting the right dose and that they're getting it at the right time of the day. And so working with doctors and working with parents to make sure that children are getting appropriate medical attention. Also repeating and simplifying instructions. And so children with ADHD really need to hear instructions more than once, and we need to make them as simple as possible. Don't make the instructions a paragraph long if you could really say them in one sentence, right? Try to simplify the instructions. Also, state clear expectations. The child needs to know what they are expected to do very clearly. It'll help them stay on task. And give immediate feedback. If the child is having trouble, let them know as soon as possible. Good? Provide structure, and so maybe this just means we have a routine every day, that we do the exact same routine in the exact same location. They know what to expect, right? And a lot of direction from the teacher. So these children may need more hands-on help. They may not be able to complete all of their work on their own, so they need more direction. They need the teacher to help them stay on task, perhaps. And this is very important, and I cannot stress this enough. Provide opportunities for students to get up and move around. Especially the younger the children are, the more it's important that they have a chance to move around. It may be a good idea to let kids take breaks and run around and play for a few minutes before they sit down and do their work, because they'll be able to think more clearly if they've had the exercise, if they've been able to burn off a little bit of energy. And finally, break assignments up into shorter segments. They'll do better on their assignments if they are given short sections that don't require sustained attention, right? If I can work hard on the section, depending on the age of the child, for an appropriate length, 5 minutes, 10 minutes, take a break and then come back, they'll do better. This goes for college students as well. College students with ADHD, I recommend if you're studying for a test, study for 10 minutes and then give yourself a break and come back and study some more. Don't try to cram. Because your attention is only there for a short period of time, and you're actually going to be more productive with your time if you give yourself breaks and you spread out your learning. And that's good for all students, not just students with ADHD. Okay. So the next thing that we'll talk about is intellectual disability, and I updated the slides to refer to this as intellectual disability. The textbook may still refer to it as mental retardation. But DSM-5 has updated the terminology to intellectual disability, likely because of the stigma that has been placed on terms like mental retardation, right? But when someone has an intellectual disability, there are a few different things going on. First of all, they have low intelligence, and this means that they have an IQ score of less than 70. So remember last week we talked about intelligence test scores and how we have like borderline functioning is like 70 to 79, right? And so we're getting close to that range. And then anything below 70, we're really concerned, right? Now, intellectual disability could be diagnosed in someone whose score is slightly above 70 if they're also having these deficits in adaptive functioning. So if I had someone who had a 73 on an intelligence test but also was having trouble with adaptive functioning, I would probably go ahead with that diagnosis. So there may be a little bit of wiggle room here, but the rule of thumb that we're going to stick with is IQ scores 70 or below. Now these individuals are going to have problems in adaptive functioning, and this can mean several different things. Adaptive functioning could mean A, they're having trouble in school, so they're not able to function in a normal classroom setting. It could mean that they're having trouble with daily hygiene tasks, taking care of themselves. They're having trouble, if they're of the old enough age, having trouble maintaining their job, right, working, or having trouble maintaining relationships and things like that. So they're just not functioning well. Now, the onset has to happen before age 18. Usually this is happening a lifelong issue. Usually this is happening from a very early age. But sometimes if it's less profound, it may not be diagnosed until the individual's a little bit earlier, but it has to be diagnosed by age 18. If something like this were to come up after the age of 18 and was not present before the age of 18, then we might be thinking about maybe some kind of drug use or some kind of brain damage, right, that has occurred after that point that might be causing these symptoms. So some different causes that can play a role in intellectual disability. First of all, genetic factors. And so we know individuals who have Down syndrome are likely to struggle with adaptive functioning and also may not do well on intelligence test scores. Other things that can be a cause here: infections, environmental hazards. Fetal alcohol syndrome is one of the highest preventable causes of intellectual disability. Obviously, this occurs when a mother has consumed alcohol during pregnancy. Usually for this to happen, it would have to be a fairly regular thing, consuming a fairly regular amount of alcohol or fairly high amount of alcohol, but this is very highly related to intellectual disability. Now, something to keep in mind is we talked about intelligence test scores last time, that they might be biased towards some individuals and that some individuals might be better test takers or they might be less anxious and so they might do better. If I had a client who didn't do well on an intelligence test score, who had maybe a score of 70 on an intelligence test score, but they didn't have those deficits in adaptive functioning, so their relationships were fine, they were doing fine in school, they were doing fine at work, then I wouldn't make this diagnosis, right? It's important to keep in mind we have to have both the low intelligence and the deficits in adaptive functioning. But most individuals who score that low on an intelligence test are also going to have deficits in adaptive functioning. Okay, so just something to keep in mind. So teaching strategies when working with students with intellectual disability. Individualize instruction, because you take 10 different students with intellectual disability, you're going to have 10 different presentations and 10 different ability levels. And so individualizing instruction based on that student is of course helpful. Also giving concrete examples. We talked about Piaget and the different stages of development. Individuals who have intellectual disability are likely to struggle with that formal operational stage. They may never reach that stage where abstract thinking comes easy to them, and so giving concrete examples can help. Giving students lots of opportunities to practice, to do a lot of assignments, to get a lot of feedback so they know how they're doing. Have positive expectations for learning, right? So these individuals can learn. It's not that they cannot learn. It's not that they cannot get better. It's just that they're likely to struggle and to need more help. But have positive expectations. As we've already talked about, we don't want to set up this self-fulfilling prophecy where they feel like they cannot learn, right? And also look for support, because working with individuals with intellectual disability is going to take a lot of time, it's going to take a lot of energy, and this may be more than the typical teacher can do in a classroom with a lot of other students, and so we might want to be looking for other support to help. So we'll leave off there today. Next class period on Thursday, we'll talk more about different types of disabilities and different strategies for working with other types of students. So once again, I apologize for having to cancel class today, but I hope you guys were able to get a lot out of this lecture, and we'll finish it up on Thursday. I'll see you guys then.